Good morning, everybody. My name is Antonia Anoloha. I'm a DMP student from Brandman University. I'm in the class of Dr. Clary, DMPU 705. I'm here to present Proactive Health Communication Campaign. Overview: Uncontrolled hypertension. Hypertension is a symptomless condition that damages blood vessels and leads to serious health problems if it is not adequately managed. Approximately half of US adults develop hypertension, which is defined as systolic blood pressure equal to or greater than 130 or diastolic blood pressure equal to or greater than 80. According to CDC, about half of US adults have uncontrolled hypertension of 140/90 or higher. Uncontrolled high blood pressure is the leading cause of stroke, heart failure, heart attack, renal failure, and premature death. The risk factors that contribute to uncontrolled hypertension include medication non-adherence, smoking, obesity, stress, lack of exercise, excessive salt and alcohol intake. The topic is antihypertensive medication adherence, which is one of the management of hypertension. Other management of hypertension include increased physical activity, smoking cessation, stress and weight management, healthy diet, low salt and alcohol consumption. Antihypertensive medication adherence. Agenda: identifying the population at risk, describing health risk, describing health promotion, importance of medication adherence, theoretical framework, multimedia approaches, resources, references, and questions. Population at risk. I live in Culver City. Culver City is a city in western Los Angeles County, California, with a population of 40,351. The city of Los Angeles surrounds Culver City. Approximately more than half of the adult population has hypertension, age 20 to 75 years, that is uncontrolled. Health risk. Uncontrolled hypertension. Uncontrolled hypertension is the major risk factor for heart diseases, stroke, and fifth leading cause of death in the United States. In 2016, 82,735 deaths were primarily attributed to uncontrolled high blood pressure. The total cost of uncontrolled hypertension were $55.9 billion in 2015, and the estimated cost by 2035 will be $220.9 billion. Uncontrolled hypertension adds extra burdens to the patient, family members, and caregivers. What is happening here? What is happening is medication non-adherence is one of the risk factors that causes uncontrolled hypertension. So with the use of flyers and telemedicine, include text messages, phone calls, and visual classes, we help to educate these people about hypertension, its complications, and the importance of medication adherence. The importance of medication adherence. Patients adhering to medication and positive lifestyle behavior reduces hypertension complications, including heart failure, kidney diseases, premature death, and heart and health care costs. What is medication adherence? Medication adherence is taking medication as prescribed and adopting lifestyle modification recommended by the healthcare provider. Health theory. I adopted Dr. Faye Abdullah's theory of 21 nursing problems, which is a conceptual model concerned with patients' need and nurses' role in identifying the problem and using health educational information to solve or reduce the problems. The 21 nursing problems are divided into three major categories. Problems common to the patients: physical, psychological, and sociological needs of patients; interpersonal relationships between nurses and patients. Dr. Abdullah's theory applies to my clinical scholarly project, Telehealth Education to Improve Medication Adherence for African American Adults with Hypertension. Multimedia approaches to improve medication adherence, which includes phone calls as a reminder system, texting message as a reminder system, visual classes to educate the patient about the importance of medication adherence, infographic about the importance of medication adherence, daily pill setup to help the patient to take their medicine daily, electronic medical record to identify patients that are not taking their medicine and help them, flyers about the importance of medication adherence, complication of uncontrolled high blood pressure. This is the flyer that I developed, which is multimedia example. On these flyers, I discuss about what is high blood pressure, what should one know about taking their medicine, how can one remember to take their medicine, what type of medicine may be prescribed, what are the side effects of medication, what is the side effect of antihypertensive medication, and complication of uncontrolled high blood pressure. The other flyer, which is this one here, describe about healthy life modification, which includes eating a healthy diet, maintaining a healthy weight, smoke cessation, increase physical activity, limit salt intake, reduce alcohol consumption, and always keep doctor's appointment. And this is the next multimedia example: patient-provider communication and interpersonal collaboration. Patient-provider communication help the provider to identify the reason patients are not adhering to their medication, which includes their belief, fear of side effects of the medicine, forgetfulness, cost, and uninsured. And this will help the provider to collaborate and communicate with other healthcare workers, such as social worker, case manager, discharge planner, and pharmacist, to help this patient to take their medicine as prescribed. The goal of Healthy People 2020 is to improve high quality care, promote health, prevent disability, and premature death. And this is another example of multimedia community engagement, here involving the stakeholder and educate them the importance of antihypertensive medication adherence, complication of uncontrolled high blood pressure, and also community outreach, raising awareness about hypertension and adverse effects of medication non-adherence, using webinar to communicate with the communities and the community advisory board about the importance of medication adherence. The resources: fact about hypertension from CDC, small changes will make a bigger difference in managing your blood pressure, from American Heart Association, Health and Social Service in Culver City, from Culver City website, what is high blood pressure, from American Heart Association. My email is aanuluoh@mail.brandman.edu for any question. Thanks for watching and listening to my proactive health communication campaign. This is my references. This is my references.